For this episode of Health License, we'll be talking about acne and why you should see a dermatologist for your acne while I do my facial routine, because I need to go see a friend. So yes, so for face routines, one thing that everyone should know is no matter what kind of skin you have, whether it's normal, dry or oily, there are 3 steps that everyone must have for a face routine. You must moisturize, you must cleanse, and you must apply sunscreen. Whether you're black or not, those are the 3 steps that are a must for everyone. So right now I'm just toning. It's a toner and a cleanser at the same time. So let's talk about acne. So why I think I'm going to give you 6 reasons why you should visit a dermatologist for your acne. So the first reason is acne is an actual medical condition and has numerous causes. Causes could be bacterial, it could be hormonal, or it could be that you're just a disgusting person. Let's say you don't shower immediately after you leave the gym, or you don't change your pillowcase, or you don't clean your phone. Those could be other causes of acne. You could also just have acne because you are producing sebum that it's really thick and it's clogging your pores. Yes, so there are so many causes of acne. This is why you should see a health professional to determine what exactly is causing your acne. Reason 2 why you should see a dermatologist for your acne is there are very many skin conditions that are there. There is so many skin conditions that could be misdiagnosed as acne. For example, folliculitis, that is sometimes caused by a fungus, sometimes appears as acne. So you should see a doctor to establish the exact cause of your acne. Reason 3, okay, so this is my vitamin C serum. Let me just look at my mirror. I know you can see me shaking. I suffer from anxiety, and sometimes I overthink situations like this video, so that's why I'm shaking. Yes, so that's my vitamin C. The third reason why you should see a dermatologist from your acne is if you've been using products. You've been using OTC, over-the-counter products to treat your acne. For example, I saw that there's a company called Acne that has a facial wash, a toner, and I don't know the other. I think it's a moisturizer with mentholatum for your acne. So if you've been using such kind of products for a while, let's say 10 to maybe 3 months, and you've not seen any results, the acne is not changing, it's time to see a dermatologist for your acne. The third reason why you should see a dermatologist for your acne is in case you have inflammatory acne that presents with a lot of pain and a heat around your face, or you have acne that is cystic or nodular. So cystic and nodular acne, usually when you feel your breakouts, they have lumps underneath the skin. That's cystic or nodular acne. So for cystic, you'll feel like the lumps are kind of smoother, while for nodular, you'll feel like they have formed a tight knot under your skin. Yes, so if you have cystic and nodular acne, you should probably see a dermatologist, because these forms of acne are not treated by OTC drugs. You'll need stronger drugs like tretinoin, spironolactone, or contraceptives. So you'll need to see a doctor for that acne. And this type of acne tends to scar. So it's really important that you find the right drugs for it. And yes, this is the next step is my tranexamic acid. I have hyperpigmentation around my eyes and in other areas that you can see right now because of the phone I'm using and the ring light. So it makes it look more even, but essentially I have some dark spots that I've been working on for a while. So tranexamic acid essentially it blocks melanin production so that I get a more even skin tone. While you're applying your products, please make sure the applicator doesn't touch your face, because it will lead to transfer of bacteria. You need your product to stay sterile. So the fifth and the sixth reason why I think you should see the dermatologist for your acne is essentially if you think your acne is caused by drugs that you're taking. For example, if you're using contraceptives, those can cause acne. So it's really important to see a doctor, because I don't think there's a medication in this world that a doctor can't find a substitute that works for you. So see a doctor and find a substitute for that drug that does not produce that side effect. Another thing that might warrant you to go see your dermatologist, if you feel like your acne is causing you to have you to be depressed or is changing your moods. Yes, especially if you're a teenager. It's kind of when there's an age where your outward appearance really affects your inward feelings. Does that make sense? Yes. The next step in my routine is applying a facial cream that has SPF. I usually don't like sunscreen because I don't know if my eyes are sensitive or it's just something that happens with sunscreens, but I usually find that they really burn my eyes. They produce a lot of itching when they come in contact with my eyes. So I'm usually very careful when applying any product that has sunscreen. So 10 things to try, or not 10, a few things to try in case you have acne and it's not inflammatory or nodular or cystic, and you haven't tried OTC products yet and you just want to try those, or you can't afford to visit a dermatologist and you want to just exhaust your options before you go see one. You can always try products. You can try 2 different products at a time, 2 different products which work differently to treat your acne. These are usually OTC, over the counter, which means you don't need a prescription for them. Most of the time when you go to buy these products from companies or other pharmacies like Good Life or VitaFarm, they have consultants who are available who will give you information on which product to use or whichever skin type you have or whichever acne you have. So a few of these products include benzyl peroxide. I'm not talking about benzyl peroxide, I'm talking about skin grade benzyl peroxide. Sio ya kudisinfect vitu na wounds. Hiyo itakuchoma uso shangai. So skin grade benzyl peroxide that has been diluted to a level that your skin can handle. Okay, this really takes me some time. Yes. So benzyl peroxide basically is an antibacterial. It acts by killing the P. acnes that is on your skin, which is the bacteria that causes acne. It also causes the acne to burst and dry out and basically have a better appearance than whatever was there before. So benzyl peroxide is usually available as washes or cleansers, essentially because benzyl peroxide, when you use it as any other thing that is not a wash or a cleanser, it has a tendency of staining pillows and staining clothes. So the most convenient way to use it is as a wash. Yes. So it's one of the things you could try as an OTC product. You could also try retinoids such as adapalene. So adapalene and tretinoin, they are both retinoids, but tretinoin is a stronger retinoid, so it's prescription only, while adapalene, some products of adapalene gel are available as OTC. So you can buy adapalene gel. Retinoids tend to decrease inflammation of the skin. They also decrease the oiliness of the skin and decrease whiteheads and blackheads. Yes. The thing with any product that has a retinoid is it tends to irritate your skin when it comes in contact with the sun. So you might choose to use it only at night, or when you use it during the day, you'll have to apply a sunscreen. Yes. And another thing about retinoids, you can't use them when you're pregnant. Yes. And retinoids, another thing about retinoids, I have to apply sunscreen. Yes. Most retinoids are not used daily, so After you talk to the health professional, they probably tell you 3 times a week or twice a week, depending on your condition or the strength of the. Okay, another product you could use is salicylic acid, aspirin. So salicylic acid, for those patients who have inflammatory acne, it tends to decrease this inflammation. And then there are studies that have shown if you use salicylic acid for consistently for 12 weeks, twice a day for 12 weeks, it has been shown to reduce the appearance of, to improve the appearance of the acne, to clear whiteheads. Yes, so there is actual scientific proof that salicylic acid helps to clear acne. Another product, another active ingredient that you could use is azelaic acid. I have used the product before. It helps to clear the brown marks that stay after your acne has healed up. So you can also get azelaic acid. You can also use chemical exfoliants. They are the fastest way to get an even skin tone. The thing is, you can't use chemical exfoliants on the daily, and you also can't use chemical exfoliants on active breakouts. So you have to first heal your acne, then is when you can start using chemical exfoliants to clear the black marks. Another product you could use is tea tree oil. Tea tree oil, though, has been shown to have a high occurrence of allergies in certain people. So the first thing you do when you buy your product that has tea tree oil, maybe apply it on your wrist, let it stay overnight, and check on it. If you see any redness or a rash on that area, you know that you have allergies to tea tree oil. So we've discussed the different products you could try OTC, like benzyl peroxide, salicylic acid, glycolic acid. Glycolic acid is a chemical exfoliant. We've talked about azelaic acid. We've talked about retinoids such as adapalene, which are sold over the counter, and we've also talked about products that have tea tree oil. So once you buy your expensive, because you both know how much those facial care products cost. Once you've bought them, it's really important to understand the instructions and use them according to these instructions. For example, while I'm doing my face routine, I did it the wrong way, because essentially after each product, I'm supposed to wait for at least 1 to 2 minutes for it to be absorbed before I can apply the next product, so that the next product does not dilute the initial product I had applied. Those kind of instructions are things you should follow. When you are washing your face with a cleanser, it should at least take 2 minutes to just let the cleanser, because the cleanser does not just have soap, it has soap plus other things that are useful for your skin, so you're supposed to give it time to absorb. So at least 2 minutes just rubbing it on your skin. So that's the thing, when you are using these products, follow instructions so that you get the best out of these products that you purchase so expensively. You might also need to wash your face twice a day, because you've seen, like I've just told you, the study that was done on salicylic acid, it showed effectiveness if it was used twice a day for 12 weeks. So use your products twice a day. And if you are using more than maybe 3 products, maybe you can use 2 in the morning and 2 in the evening. And don't forget that retinoids should preferably be used at night because of the irritation effect they cause. Then another thing, we've talked about getting the OTC products, then following instructions, then washing your face at least 2 times a day. What else should you do? You have to use the OTC products for at least 10 weeks to 3 months before you can now say, I don't know the word, I don't know the adverb, before you can now confidently say that the products don't work for you. Then the one thing tuliambiwa about pimples tukiwa high school, tukiwa in our teen years, don't pick or scrub those pimples. Just let them heal. Let the product do its work. Let it heal, because once you scrub it, then definitely it is forming a scar, because essentially you've opened up the skin. Now it's a whole wound, so it will form a scar. So just avoid picking the pimples, and also just avoid touching your face. Utashika uso, you're touching your phone, you're touching things when you're walking for support. Once you touch your face, you're basically transferring bacteria to your face. On that note, also wash things that touch your face. Like wash your pillowcase maybe 2 to 3 times a week, and maybe just sanitize your phone once in a while. I tend to forget as well, but I usually try when I'm talking on the phone, I try not to let the phone touch my face unless niko tao penye lazima nikue hivi. But ka siko tao, I try to avoid letting the phone touch my face. Wash the whole of your face. Then when you're applying the product, apply it to the whole of your face. Don't go shush, 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 shush. Don't start applying it only in the area where the pimples are. Back to my face routine. I started by cleansing while showering. Then I toned my face while also cleansing it again, but that's not advisable. You should just cleanse once, because if you cleanse too many times it will irritate your skin. Then I applied my vitamin C because I want that radiant skin. Then tranexamic acid, which essentially blocks the production of melanin on my skin. Then a moisturizer. I don't use facial oils. I tend to sweat a lot when I apply facial oils on my skin, so I don't apply facial oils. Then I apply moisturizer that has SPF. When you're applying sunscreen, please remember to follow the 2-finger rule. I tend to apply a very generous amount even without the rule, but initially I started with the rule. Remember to avoid your eyes, because sunscreen will irritate those eyes like no one's business. You'll be crying the whole day. Anashanga kwa nini nakasirika. And then their usual assumption you match. I don't know why. Anyway, yes, apply generous amounts of sunscreen on your face and go and enjoy your day and jump in the sun. And I hope I see you here next time. Thank you so much for watching my video. Have a lovely day today. Bye bye.